Okay, so this week I decided to do effective anterior cruciate ligament reconstruction with a meniscectomy on length of career in National Football League athletes. Because of course I'm interested in the NFL. So basically, this article is about meniscal and ACL injuries as well as the surgical treatment for them and how it's been shown to decrease the probability of playing professional. And then the effect of a meniscectomy and or ACL surgery on the length of an athlete's career has not been like super studied in the NFL. So this article is where they kind of bring it out more and highlight it. So both of these procedures can have obvious implications, of course, just like anything. For the durability of an athlete when faced with high demands, especially in professional sports, because they have like the intensity is higher. So this case study took 54 athletes with a history of meniscectomy, 29 with a history of ACL reconstruction, 11 with the history of both. And they found out the history of an ACL reconstruction was associated with a shorter career for offensive linemen. And that kind of has to do with weight, but it talks about it later. And then the meniscal injury was associated with shorter career for athletes in the defense secondary. So it just kind of studied the effect of ACL injury on running backs, wide receivers, already playing in the NFL, and then found that less than 80% of these athletes returned to play, and the performance who did return was reduced by 1/3, which is not a lot, but it's still a big amount for a pro athlete. And
That's
then
very
huh?
significant. I said that's very significant.
Yeah, especially when they're playing that high of a level. So
There's
basically before they
because there's so little separation between athletes at that high of a level, and so any decrease in ability is magnified by tenfold.
Well, and then they'll usually get replaced too, super quick if they lose any sort of uh, thing that makes them stand out.
Yeah.
Oh, so they hypothesized. Where did they go? Just she threw me off.
Go ahead.
Oh, so they hypothesized that athletes with a history of a mastectomy or ACL surgery likely have a shorter career. And they used a database containing injuries and surgeries for all 5,047 athletes reviewed at the combine, because that's where they usually do like pre-assessments for college kids that are trying to draft. And they did that from 1987 to 2000 and created like a database of all of it. And then they kind of did the number that they were drafted at, the number of seasons they played, the number of regular seasons or playoff games that they played in, and then they ended up with 2,845 athletes who wanted to play, and versus that 5,000 number, at least one game in the NFL. And then they got all of the athletes with a history of mastectomy and ACL reconstruction before the combine who at least played one game in the NFL were identified in this. Um, and then the history of meniscal repair were not included in the study, which I thought was interesting because it's kind of what this is about. So this is where this gets kind of confusing, um, because it makes it sound like the athletes are athletes that got hurt in the NFL, and the title is what you would think, but it's really pre NFL, and if they keep playing. Um, so the isolated mastectomy, the results were reduce the length of the career in years, 5.6 versus 7, and then games played were 62 versus 85. And the isolated ACL surgery did not significantly reduce the length of a career in years or games played. I mean, you can tell it's not a huge. I mean, the 62 versus 85 was pretty big, but the 5.6 versus 7 is, but isn't.
Year and a half.
And then comparing, hmm?
So it's a year and a half.
Yeah, so it's not, if you think about seasons and stuff, it's not really that long. And then comparing athletes with a mastectomy or ACL reconstruction to athletes combined ACL reconstruction, so like both of them, a history of both surgeries resulted in shorter career in games So 7.9 versus 35.1, which I don't know where they're getting their points from. Games played, so 41 versus 63, and years 4.8 versus 5.8, which the years isn't really big of a difference in this one, but the amount of games to me is a lot higher than a history of either surgery alone. So if you have both of them, of course, it decreases your playing time and the amount like the longevity of playing, which makes sense. I mean, if you think about
You
it,
had a more significant injury to start with.
yeah. And then, so a combination of ACL reconstruction and meniscectomy is detrimental to athletes' durability than either surgery alone, which of course makes sense. And then there just may be more initial chondral injuries with both of them, and then which predispose them to a shorter career. And then there's no medical data from athletes' NFL career and no data on actual case for the end. Like, why did they end? You know what I mean? Or medical or otherwise. Like, there's not enough data on that for them to be like, oh, this is like really what ended their career. But it is possible. So the study did not look at meniscal repairs because there was not a significant number available in the database of athletes who were evaluated at the NFL Combine in the late 1980s and 1990s. So there wasn't enough. There was data for ACL, but there wasn't for meniscal. So that's why they threw it out, because it would have skewed.
Yeah, meniscal repairs probably weren't as common at that time.
Well, that and that which makes it the title interesting because this is what we're focusing on. You know what I mean? So isolated ACL reconstruction did not reduce the mean length of the career, but the median length of the career in years and games played was higher in athletes with a history of ACL reconstruction than their controls. And then athletes with a combined history of ACL and meniscal surgery did have a shorter career, like we talked about, but it wasn't a huge difference. And then athletes with a history of ACL and meniscal started significantly fewer games than athletes with just isolated ACL reconstruction or meniscal resection. So there was a trend towards shorter careers, like I said, and then kind of just shorter start times. But that, like we talked about, it makes sense because it's a bigger surgery.
Yeah.
So meniscectomy did shorten the length of a career as athletes with a history of mastectomy were 95% confidence interval more likely to have a shorter career than those with no previous, which of course, I mean, if they don't have an injury, why would they? And then a combination of ACL reconstruction and mastectomy may be more detrimental to their durability than either surgery alone, like we talked about. And further research is warranted to understand how these injuries and surgeries affect an athlete's career and what can be done to improve long-term outcome. I found it interesting that there wasn't a huge age difference because it talks about in the article that for ACL, it was 1.2, meniscectomy was 1.4, and both of them combined was 1.3 year difference on the people that they had, and those were the highest age difference. But it doesn't tell you what age they were looking at. Like, it doesn't give you the range. So you don't know if you're looking at, like, you assume you're looking at younger athletes because we're talking about collegiate drafting going into the draft. So normally they're younger. But it doesn't really, I think that they could have done this better and explained it better when they did this. I do find it interesting that they decided to look at this one. And then they also said that another factor relating to detrimental effects of a mastectomy is the athletes with a high body mass, like their BMI is higher, because they don't really explain why, but you assume that the surgery, like the weight of that player, the surgery can't handle.
Yeah.
So, so like the least overweight ones recovered better, and then the more overweight did not. Just because your body's not supposed to handle that kind of thing, and then if you get surgery, you know, it's less likely to be able to withstand that. So, and then they kind of go into explaining different meniscal, like why the meniscus is so hard for it to withstand these changes, and then why both of them, like the instability of it, the lack of support, because it's both ACL and the meniscus, not just one or the other, kind of stuff like that, just to give people like a background on it. But I wanted to know why they didn't use even number overall for the injuries, like if it was a possibility or not. They didn't really talk about that because I think it was a little skewed with the so many in this number, so many in this number, and so many in this number.
Yeah.
And then I wonder what the age group was, like we talked about. I also wonder what the most common injury to pull NFL players out of playing, if there's like a specific one to end their career sooner. And I wonder why they chose to look deeper into this. And then I also wonder what the stats of those players, if they had these injuries in high school or if they had them in college, or if it was both, or if it was just college. Like it made me wonder, like, are we looking at only college injuries, or are we looking at they had it in high school and college, kind of like where?
Yeah.
And if they left out some of the information that could have affected it. And then could other leg injuries increase the probability of not playing because of this injury? But they didn't really talk about that either, which made me curious if that would affect the data.
Yeah. I'm kind of, I would be
But
curious to see if there's data related to um, whether or not it significantly reduces it even more by it being like a bilateral, like if they had to have both ACLs replaced. Because there's, I mean, I would think that there would definitely be some guys that have. Um,
yeah,
and so, how much does that shorten a playing career in an already, 7 years is what the average was for non-injured athletes, healthy athletes, and so that's already a short time when you think that
yeah. So it's
for a career.
well, and I also wonder because the like pro football players, their career is so short, anyways. So I wonder if the position has to do with it too, of them just being pulled early because it's already a short career. They do this from their like middle 20s to maybe middle 30s if they're lucky, and they usually don't go past that. So it's already like a 10-year, if even that, gap. So I wonder if that has anything to kind of like skew the data a little bit. But like we talked last time, like a lot of things can skew data.
Yeah.
But I believe that this would be something helpful for like athletic trainers in various different ways. Like pro football athletic trainers could use this to help push studies of like decreasing the surgery if they could. Or if pre-op treatment helps recovery and success rate to continue to play. Because I know that's been something that athletes have been looking at more in the past 5 years, is like what is pre-op um, interventions
Yeah.
do. Yeah, prehab. So I wonder if that could help change some of the data for the next couple of years if they redid this study. And then I also think they can tie it into preventatives for college and high school players to increase that injury rate if it's possible in different ways. I'm not exactly like sure off the top of my head what, um, but I said this article makes me wonder like what they left out when comparing the statistics. And then I think this article, they could have worded it better and kind of organized it better. Um, and I believe like the title and the opening are kind of confusing to what we're like going to talk about. And then I believe it just could have been worded better. I think they should have just like gone from ACL, mastectomy, and then both together. And I think they shouldn't have like jumbled them together as much. And then they would explain like why those surgeries were so big, and then they would jump back to stats, and it was just too jumbled, I think.
Yeah.
But
All right. Sounds good. I mean, anything NFL wise, I'm going to be interested in it. You would think that with the NFL that there would be better statistics, but it's old. It's an older survey, and so I would be interested to see what the difference is now with modern surgeries, where we have more people actually having surgeries, but we have better recoveries from those surgeries. So, I mean, it's kind of one of those deals.
well, and it's interesting. Like I was listening to the draft, some of the draft talk today, and like Tua with his like broken hip and how he has jumped back so fast from healing. I wonder if like stuff like this, if they kind of compared how do people heal better and faster now, especially with that ankle injury that they had, and then they replaced. I don't remember exactly. It was very interesting. They ended up doing, I think, a graft into the ankle, and he ended up healing faster off an ankle sprain somebody did. I have to look back into that. But you're right, with modern science, I wonder if this could be different.
Yeah.
Mm-hmm.
Very interesting. All right. We can go ahead and
Yes.
look at mine now. Let's see. All right. Can you see it? Can you see mine?
Yeah.
Okay. So my case report was it was just a straightforward case report. So it was one patient, and it was just about his recovery from an acetabular labrum tear. He had surgery, and this is the physical therapist that worked with him. It's the case report that the physical therapist wrote. So basically, this kid is a 18-year-old that is coming from college or from high school, and he's gonna play college ball. He's a free safety. He's 6 foot 205, and so he had a acetabular labrum tear that they believe was caused by a bony deformity on his femur, and so yeah. Uh, so they talked about how they fixed, or they briefly kind of covered how that was fixed in the surgery. But the talk about the surgery was very brief, like one small paragraph, and then the rest was about his recovery and what they did in physical therapy. So, um, so basically, he came in. He was having 2 out of 10 pain at rest, 4 out of 10 whenever he was on a crutch, and 5 out of 10 if he tried to do hip flexion and internal rotation. But if he used Vicodin, then the overall pain was 2 out of 10. The wound healing, whenever he came in for the first time, which was 2 days post surgery, was looking really good. They said that the steri strips hadn't moved at all, so they went ahead and they replaced those steri strips and cleaned the wound and everything. But he was doing good um, as far as the scar is concerned. His range of motion, as far as in his knees and his ankles, the findings were insignificant. They were within normal limits. And then muscular wise, he was a 3 out of 5 on all hip movements. So 3 out of 5, if you remember, is do you remember what the grading scale is? I'll quiz you.
That is, so one is not able to, two is some muscle movement. So he can do it against gravity, I believe.
Yes. So just against gravity, yes. No other external force. He could do all of his hip movements, but they were painful. They were what caused the 5 out of 10. So, and then palpating, he had moderate tenderness, is what they described it as. So that's kind of what they gave you as far as the patient. He was on a passive movement device for like 6 hours a day, which seemed like a lot to me. But then again, I mean, I understand that you want to keep that movement to help kind of pump out the edema. So that's what he was doing at home during this time. And so, and his range of motion was restricted to 0 to 90 degrees on his hip. And that was the movement that the machine was taking him through as well. So, and I think that he was restricted to that for 6 weeks.
6 weeks?
Or 2 weeks. Sorry, 2 weeks.
I was gonna say 6 weeks is a long time.
I know. I was thinking about something else later on in the report that's 6 weeks. So summary of interventions, they basically talked in depth about each phase, and I just summarized it because it didn't need to be as in depth as what they were giving me for this. So phase 1 of the rehab was our initial phase, or what we would call our inflammatory response phase. And so we were just looking to make sure that we were protecting the tissue that had repaired itself already or was repairing itself during this process. We wanted to minimize pain and inflammation and improve his proprioception, but like not weight bearing proprioception, just movement and neuromuscular control, basically. So his exercises during this were just non-weight bearing, an upright bike with no resistance, ankle pumps, towel slides, internal and external rotation with the help of a chair. That was an interesting exercise that they were doing. He basically just had a chair and he was moving it back and forth with his foot on the chair and he was standing holding a rail. So just to kind of lightly work on that internal and external rotation. And so the goal was to, and yeah, he stayed in that phase for a full 6 weeks. So I guess it was 6 weeks that he was restricted. And they talked about how that was a doctor's order that he wasn't allowed to progress faster than 6 weeks. So
that's interesting. That seems so slow.
It does. I think that it was because he was in the off season and he was making the transition that he's probably going to redshirt his first year anyway. So there's no need to really rush things. Then they moved on to phase 2 after 6 weeks. The goal of that phase was to again protect issues that had already healed. Again, restore range of motion, but then on this one they were looking to get back to a normal gait pattern and work a little bit on strength. So exercises were squats. They talked about how at first he was not going to go to full depth, obviously, but then they wanted to increase, and by the end of this stage they wanted to be at full depth squats. They talked about how a lunge is more more difficult on a patient from a hip perspective as far as like range of motion, because a squat you're just working in one plane, you're just going up and down one plane, but a lunge you're moving forward and back and up and down. So but everything in this phase was a closed kinetic chain activity, just to kind of make sure that the stability is there and he's not going to re-injure himself. And then the manual therapy right here was started by the clinician. So they didn't want him stretching or anything for the first 6 weeks either. And so here they started with some light joint mobilization, and they called it passive range of motion work, but basically it was light stretching. But he progressed through this phase really fast. He was only in this phase for 2 weeks. So 6 weeks in kind of the initial stages of a rehab, and then 2 weeks in the kind of the middle stage. Phase 3 was the advanced stage. So this was kind of where we get more to like our proprioceptive and balance type things. They talked a lot about how they utilized a TRX system. It was almost like it was an ad for the TRX. And so I think that might have kind of been what it was, honestly, is TRX might have funded this research. But they use
it. They promoted it, it sounds like.
Yeah. So they use a TRX suspension system to do multi-directional closed chain activities. And so basically a lot of that was like in a handstand position, and he had his feet hanging from the TRX, or not a handstand, a push-up with his feet in the TRX cables, and would do different movements with that to work on hip range of motion, but with the lower risk of injury. And they talked about there's other things that you can do instead of using the TRX. And so, so I meant to put some of those in here, but they kind of discussed different exercises that you could do. And it was all in this, it was like side lunges and planks with a leg, like they called it a three-pronged plank. So hands on the ground and 1 foot on the ground, affected leg raised to kind of strengthen that muscle a little, strengthen the musculature in that area a little bit, because he's having to hold the leg up. So then we move on to phase 4. And so this is kind of like phase 3, I meant to say how long it lasted. It doesn't say. Phase 4 of rehab was the sports-specific training portion. It generally starts 16 weeks in. Scroll. Generally starts 8 to 16 weeks in. He started. It was, I guess, phase 3 was. He started 12 weeks in. So, So he was 6 weeks in the initial, 2 weeks in phase 2, 4 weeks in phase 3, and then 4 weeks in phase 4, which is what we're talking about here, which is like kind of starting plyometrics and starting sport specific training. And so they talked about how they do really extensive training with him because that's what his coaches are there for. So they wanted to make sure that he was able to do the training safely. And then once he's able to safely perform, that's when he's done there. And so it took him 4 weeks of this to where they felt like he was able to do that. And they had criteria for him to meet. And he met it on time at the 16-week mark is when they said they generally try to let these patients go. And that's whenever he was cleared to go back to practice, not full-on contact or anything like that. So summary of comparative measures was kind of it's almost like they made a straw man argument. Do you know what that is? You ever heard that term? Mm-hmm. So straw man argument is whenever you like it's considered a fallacy in like debate. So it's whenever you present your partners, like whoever you're debating, you present their topic in a very weak manner. So like a straw man, right? A very weak defeated. So for them, their two things that they compared it to were no surgery, just rehab, and surgery, no rehab. They didn't compare it to a surgical intervention with a rehab. And so, I mean, it was pretty simple. If you don't have surgery on a labral tear, it's a avascular area of the body, so it's not going to heal. Basically, you're going to have a chronic pain, which is kind of where I'm at. And then if you have surgery and you don't do a rehab program, chances are you're going to get better, but it's going to take longer and you're not going to get back to where you were originally. And so they kind of said, my questions kind of focused around like, what was he like afterwards? They gave you a 1 month mark and a 4 month mark as far as like he came back and did testing and stuff. And it wasn't focused around like his performance. It was just focused around his pain and range of motions and things like that. And he didn't report any more pain. He had lost some flexibility initially in his hamstrings, but that was reported to be back to normal by 4 months. And so my questions were kind of like, how did he have success on the field again after this? Kind of like what you were talking about in yours. How long did it take for him to have success on the field again? Did he see a drop in measurables like a 1 rep squat max or a like a endurance based squat test or lunge test or anything like that? Or like did he lose any quickness like the shuttle drill or the 40-yard dash or any of those areas? Like was he truly back to 100% following 16 weeks or 20 weeks or at what point did he get back to full 100% or did he ever? And then I also just wanted to know like what was his perceived recovery? They didn't put that in there. And so yeah, I thought that would be interesting to know, like, did he feel like obviously he's testing better and he doesn't have pain, but how does he feel like he's at? Is he scared of re-injury? type of thing.
Yeah, is he confident in his movements and everything? I agree.
Yeah. And then how can I apply this? It talked early on in the deal about how labral tears based off of where they refer pain. So they talked about it referring pain to the low back. I've never had that. I mean, I have a labral tear. I've told you that before. I'm pretty sure my hip. I've never
Yeah.
experienced any low back pain from it, but I guess you could. It talked obviously the most common is groin pain and clicking and popping, which I've had plenty of both. And so how the groin pain is often because you'll have groin pain and you'll have weakness because whenever you go, your body kind of naturally inhibits. It doesn't want you to move that way because it hurts. And so
Yeah.
whenever you go to like test something like the groin or a hip flexor or stuff, all that stuff is going to be you're going to have positive findings on that stuff because they're going to be weak, just not trying to be. They're just inhibited by pain. And so it was talked about it how it's commonly missed, and this isn't something that we can just go misdiagnosing because if you do, then people will have pain for. I mean, it turns into a chronic issue. It's like I said earlier, it's avascular. It's not going to heal. And so just really being able to test good for it and kind of knowing, and then the rehab itself, although it was very biased towards the TRX stuff, was good rehab, and so that would be a good thing to have in my clinical practice in the future as well.
I wonder two things with this. I wonder if they hadn't put a time frame of 6 weeks on the one stage, if he would have progressed faster. And I also wonder if it would have helped or hurt if it had been faster. And I also wonder if they had used other things besides like the TRX as like major things, if it would have helped or hurt. Which I mean, you don't know. Like,
Well, and don't get me wrong, I think TRX is a great instrument that we can use if it's available to us, but that's not. I mean, I just don't think that it's available in a lot of training rooms. At least
I
I
don't see it in a lot of places, but I hear about it.
yeah. So yeah, if it's there, great, use it. Yeah, but if not, like we still have to be able to work with what we have and be able to.
Yeah.
But I I mean, I wanted to research labral tear and stuff because of me, and so in my situation, and so it was interesting to see kind of what he went through and kind of what my rehab was, which was not much. And well, and oh, I meant to say, you were talking about how 6 weeks seems like such a long time, and it is
Yeah.
for that initial stage. But then his overall rehab was only 16 weeks, and so that seems pretty quick. I mean, it's 4 months, but 4 months for a major, eh, I say major, a hip labral tear and reconstruction seems like a pretty quick recovery.
Well, and that to me makes it interesting that it was only 16 weeks, and then 6 of that was spent in that first kind of beginning area. And so I wonder if they should have spent more time in the like, I understand like sending the athlete to their coach who knows more in the last phases of sport specific things, but I wonder if they should have monitored more in that
And I
phase.
don't know how much. Like I said, he came back in at the 1 month mark after being released. So at 20 weeks, he came in, and then he came in at the 4 month mark, which let's see, that would be 3 more months after that. So 12 more. So like 32 weeks post op, he came back in for a checkup. So I don't know how much monitoring they were doing, and they didn't discuss that they were monitoring him whenever he was, working with his coach and stuff. But I would assume that it wasn't just, hey, go do whatever you want. It was probably
Yeah.
very structured, like hey, start out, with your ladder drills or whatever, your plyometric, your jumping and stuff, and try not to be super multi-directional and that kind of stuff, and just gradually work into it over time. And I don't know if they gave him a time frame or not. They didn't discuss it, but I'm sure that it wasn't just okay,
Here
let's
you
start
go.
football, type of thing.
Yeah.
It was interesting.
It does sound interesting. It's interesting to see that it was only 16 weeks.
Yeah.
But
If I could be better in 16 weeks, I would sign up for it tomorrow. Well, I'd also have to be able to afford it, but you know.
okay.
All right, I'm gonna stop recording now.